So we covered prevention and kind of dabbled in treatment. But is that basically all that's available for treatment with regard to this disease?
For macular degeneration, there's two types of macular degeneration. There's what we used to call the dry and the wet. And the dry macular degeneration is a slow degeneration of the macula that you have to just try to prevent. As of right now, we don't have any good medications to eliminate dry macular degeneration, or once we make that diagnosis, we can't undo the damage that has been done. What we can treat is wet macular degeneration. They call it wet macular degeneration. If someone has your typical dry macular degeneration, about 80 to 90% of patients with macular degeneration have dry type. They call it wet if it starts to bleed or leak. And then you can see that fluid, either that blood or that fluid, build up in their retina, in their macula. And then we call it wet, and there is treatments that we have for that to get rid of the fluid. It doesn't necessarily eliminate the problem. It doesn't necessarily cure the patient of macular degeneration, but it's clearing that fluid out that's been leaking, which can really do a lot of damage.
And if not treated, does the person go blind?
Blind is a tough word because it means different things to different people. But
That's true. It's a very vague term.
Right,
actually.
Exactly. If untreated and macular degeneration gets worse and worse, the patient usually ends up at about 2400, which is the big E. You might say, like, well, it's pretty close enough to blind. But remember, he or she still typically has very good peripheral vision, right? So when you close your eyes and think of a blind person, you might think of someone who needs a seeing eye dog or a cane or having trouble walking. Patients with macular degeneration can oftentimes, and everyone's different, walk around and navigate their house pretty well, but would have a very difficult time reading, watching television, maybe identifying who someone is until they get very close to them because of that damage to the macula. And then you hope that it only happens in one eye.
Jeez, that's scary.
Yeah.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.